all right. So what's it gonna be? How you guys feeling tonight? I see people are getting up. All for one, one for all. Everybody stand on your feet, arms up. Let's give it a little pump, get the blood going. All right, just gotta get on your tippy toes. All right, push a little bit. All right, now a little bit of motion there. Yeah, this is how we do it. Are you born a champion? Say, I'm born a champion. Woohoo! All right, give yourself a round of applause. Good job, good job. All right, make yourself comfortable. You ready to get started? Thanks for coming out tonight. All right, so what are we going to talk about tonight? So we've got some heart health. How many of you guys have been to a workshop before? Hands up. Good. All right. Keep your hands up if you've been to 5 or more workshops before. 10 or more? 20 or more? 30 or more? 50 or more? 75 or more? 100 or more? All right. Round of applause. Excellent. So, what you notice is that people like yourselves, smart people who enjoy learning and growing, continue to return to these. How many of you guys have been to the Heart Smart before? Good. I'm glad you're here because I'm going to be quizzing you. Yeah. To see how good your retention is, right, Denise? Yeah. So that's why I wanted you guys to sit up front. You get so much information at these workshops. Is it possible for you to get it all in one scoop? Absolutely not. So every time you come back, you're going to get something different. Tonight we're going to go through this, and I consider these events life-changing, and I'm really glad you're here because it is life-changing. If you not only digest it, but you assimilate it, and then you apply it, that's where the rubber meets the road. So who here is ready to learn something big tonight? Say aye? Aye. All right, well, let's get right into it. Keep coming back to the workshops. Next month we have cancer prevention. October is getting close to, I think it's Breast Cancer Awareness Month, right? And so, yeah, so this is a big month. There's no cure for cancer that I know other than prevention, and that's the most important one. So that's why we have this workshop, so that everybody can be proactive. So that's all I'll say about that. I could go on and on, but just mark it in your calendar. Make sure that you come back and bring a loved one, friend, family member. Heart disease. What's the leading cause? What's the leading disease killer every year in our country? Heart disease. It's not the number one cause, but it's the leading disease killer. And so we now have every 37 seconds a life is lost. Nowadays, how many people are dying from COVID every day? At the high, I think there was 3,000, but most weeks, you're looking at hundreds. So relatively speaking, where does heart disease, play as a major killer? Nothing comes close to it. Nothing comes even close to it. So it's one of these things that's just seemingly worse and worse, but it's so common we just think that it's what? Normal, right? So there's a big difference between something being common and something being normal. At some point in most of our lives, how many of you guys are familiar with having trouble with your blood pressure or your cholesterol, or congestive heart failure? These things have become so rampant in our population that we just really don't know what else to do except take what? Take pills, take medications. Well, what you're going to learn tonight are some facts. We're going to do some myth busting, especially when it comes to cholesterol. Many of you in the room were taught, if not all of you, that lowering your cholesterol to good, safe levels will prevent a heart attack. And what you're going to find out is that that's not the case at all. The other thing that you're going to learn is that the lower you take your cholesterol, the higher your risk of other health problems goes. Did you know that? Well, the jury's out. You're going to find out exactly how that works, why, and then you can make the decision. Some of you guys in this room may be on cholesterol medication. You may be on different types of medications, and your doctors have put you on there because they don't know what else to do. It's a standard of care. But you want to pay close attention tonight because there's no such thing as a drug without a side effect. There's no such thing as a safe drug. And so what you're going to learn is that the longer you stay on these medications, the higher your risk goes for other health problems, and it starts to have a compounding effect. Is that making sense? Yeah. So another fact check when it comes to cholesterol. Did you know that your brain has 2% of the body's mass, but it contains what percent of all the body's cholesterol? 25%. So your brain is largely comprised of what? Cholesterol. So isn't that interesting that's exactly how God made your body? You're supposed to have lots of cholesterol in your body. Well, I would never thought of that. I mean, that C word is a bad word. You know, we want to do everything we can to keep that under control. Meanwhile, it's abundant in our body, abundant in our brain, and we need it to think. Cholesterol forms the membranes of every cell. And all the membranes of every cell is made up of cholesterol. It's the foundation for that and many other things. And the cell membrane is where life occurs. All of the good stuff has to go in through the membrane. All the bad stuff has to come out. That cell membrane has to be permeable. It has to be functional, and that all depends on what? Cholesterol. And it also serves as a powerful antioxidant. What are antioxidants? Right? They quench free radicals, prevents cancer, anti-aging. Wow. So what you're saying, Doc, is that cholesterol really has many different benefits as far as your body functioning the way it was created to? Exactly. And when you start tampering with that, what happens to all these benefits? Well, let's take a look and see what studies are showing. Neurons. How many of you guys have neurons here and there in your brain? How many of you guys want all the neurons in your brain firing? Does that probably sound like a good idea? Yeah. We don't want to tamper with that, but the neurons depend on the delivery of cholesterol to make them actually work. What takes the cholesterol to the neurons to make them fire? Something called LDL. Wait a minute. LDL, isn't that cholesterol? No. LDL, we've been told that LDL is the bad cholesterol. But what does LDL stand for? Low density lipoprotein. So what is it? Is it a carbohydrate? Is it a fat? No, it's a protein. What is it? It's a protein. And it's used to shuttle cholesterol to the brain so that the neurons can fire. How many of you guys want neurons firing? Say aye. Aye. Sounds like a good idea, right? When you take that LDL down and you start to dial it back, what are you doing to the brain's demand for that cholesterol? You're decreasing it. And what are you doing for your brain's ability to function properly? You're inhibiting it. Function LDLs to transport life-giving cholesterol to the neuron, and it performs critically important functions there. So let me ask you a question. What happens to all these benefits as a result of lowering your cholesterol? You start to have problems. So what kind of problems? Well, for one, we can talk about what? Alzheimer's disease? Really? Taking your cholesterol down can actually increase your risk of Alzheimer's disease? Are you saying that because I'm on statin drugs or cholesterol lowering medication, I'm increasing my risk of Alzheimer's disease? Well, don't shoot the messenger. Just look at the message here. 2005 Framingham study, 1,900 patients, participants at a Boston University study that they did. And they took all these 1,900 people and they measured them for all the different functions that were affected in Alzheimer's patients, like memory, learning, concept formation, concentration, attention, reasoning, abstract abilities. And what they found was that the people whose cholesterol were lower, like were 200 or less, what happened with their ability to perform well on the test? Yep. But conversely, they said the people that had the highest cholesterol levels scored the what? The highest. So again, what did they measure? They measured all the critical functions that were lost with Alzheimer's patients, and they looked and they saw that the people who had the lowest cholesterol scored the lowest. People who had the highest cholesterols, their brains worked the what? The best. This is completely opposite than what I've learned, right? Parkinson's disease. Again, we're talking about neurodegenerative disorders because the cholesterol is affecting the nervous system. And here in this study, and this was published in a medical journal, they said people with the lowest LDL cholesterol were at increased risk for Parkinson's disease by how much? 350%. Now, what are we saying? Again, guys, I'm not just throwing out the word cholesterol. What are you looking at here? LDL, right? The low density lipoprotein, because typically what if they told you to do? Take the LDL as low as it'll go and push the HDL a little bit higher. Usually when the HDL is low, they want you to have this normal total cholesterol within these ranges, and it turns out that those ranges are contributing to degenerative neurological diseases. Can everybody see that?
Yeah.
So, what can I take to lower my cholesterol? Doc, can I take an herb? I've got this great Chinese herb doctor. Can I do acupuncture to take my cholesterol down? How about those fish oil capsules? I heard they're really good to take your cholesterol down. Brewer's yeast. I mean, what's the best thing to take my cholesterol down? And what would your answer be if I asked you that question? Diet. Oh, did you say diet? Oh, I'm sorry.
Yes, diet.
Okay, so you're saying diet. So instead of using supplements, that we should diet to take our cholesterol down, as opposed to taking statins. Okay. Have I talked about? I mean, have we seen any studies regarding statins yet taking cholesterol down? No. All we've seen are measuring people with high cholesterol and low cholesterol. And what you've seen is the brain works best with high cholesterol. And what you're going to see shortly is people live the longest with high cholesterol. So again, my question goes back to you. Should we be still looking to take our cholesterol down with supplements, drugs, or diet? Based on the research that we've just gone over, would that be a good idea?
No.
Clearly, what does the research indicate? That your cholesterol levels should be where they're supposed to be. If your cholesterol levels are running high, then there's probably a really good reason for that, other than genetically, number one, or number two, that your body is using that cholesterol for a healing process. But what you're also going to learn tonight is that cholesterol in and of itself is not an imminent predictor of a heart attack. Just because you have high cholesterol doesn't necessarily mean that you're going to have a heart attack. There are other much more important predictors than cholesterol. All right, so the answer to this question is, what can I take to lower my cholesterol naturally? Nothing, unless you want to increase your risk. Okay, so you may be thinking, yeah, maybe I should get off my cholesterol medication, but I'll take supplements and diet to take my cholesterol down. Then you might have missed everything that we just went over. And what did we do so far? Two or three out of 40 slides. Can we move on? Okay, are we all on the same page right now? Yeah. So taking cholesterol down, not a good idea, because this is not going to be reducing your risk of heart problems or heart disease, or it's going to be increasing your risk of numerous other diseases and other health problems. Cardiologist Asim Malhotra, MD, in his letter pleading to British Parliament to do an investigation on statin medications. In the past 30 years, there have now been 44 randomized controlled studies that reveal no cardiovascular mortality benefit from what?
Diet.
From diet or various drug trials from lowering cholesterol. So that goes back to saying, should we take our cholesterol down by diet or drugs? No, because over the last 30 years, 44 randomized controlled studies showed that people don't live longer when you take your cholesterol down. We got that? Most conspicuous is the recent Accelerate trial with over 12,000 patients in high risk of heart disease that revealed what? No reductions in heart attack, stroke, or death, despite a 37% reduction in LDL cholesterol. Wow. Stunning. Amazing. Because if you turn on TV, you talk to any of your doctors, what are they all going to tell you? They're all going to say, if you want to live longer, keep that cholesterol down. If you don't want a heart attack, you need to stay on that medication. Well, for how long, Doc? For the rest of your life. These are medical studies, medical doctors, medical journals. Who's responsible for your health? Your doctor, who's being educated by, drug company representatives? The standard of care to put people on cholesterol between a certain level? Created, funded, the studies funded at universities by who? Drug companies? Wow. Yeah, and your doctors are basically being influenced by them, because Big Pharma's marketing budget is strong enough to cover them and then advertised to you on TV when you go home at night. That's all you're watching, and that's all you're listening to. We bought into a huge lie. It's a big scam. Okay, now, again, I want to make sure you leave here tonight, not just stopping taking your cholesterol medication, but making sure that you do something else instead. How many of you guys want to reduce your risk of heart disease? Good. Well, you're learning an important part of it, but that's not all of it. So we're going to give you some meat and potatoes to make sure that you're proactive and you know exactly what puts you at risk for a heart attack, a stroke, or heart disease. It ain't cholesterol, though. You got me so far? Yeah. Okay. Statin medications increase your risk of death. Wow. Does that mean, really? That my cholesterol drugs can actually increase my risk of dying early? Yep. 300 adults diagnosed with heart failure for an average of 3.7 up to 11.5 years. And it was a study done in Israel recently. And here's what they found. Do you see that? American Journal of what? Cardiology? What is that? Is that a medical journal? Yeah, probably the one that your cardiologist is supposed to be reading from. You may want to ask them the next time they put a prescription in front of you and tell you to go fill it. Those who were taking the statin drugs had the lowest LDLs, were found to have the what? Highest rates of mortality. What is mortality, Doc? It's early death. Dying sooner than somebody who doesn't take the medication. Conversely, people with higher levels of cholesterol had a what? Lower risk of death. So like, if I was sitting in your chair right now, I'd be thinking, darn, what do I have to do to get my cholesterol up? Anybody thinking that yet? No? Well, good. We got more to come. More reasons to avoid statin drugs. They deplete your body of CoQ10. What's CoQ10? It's a necessary molecule that enables your cells, and especially your heart muscle cells, to generate energy. And it facilitates ATP production. That's where your energy comes from. So the statins strip the CoQ10 out of the cells. It inhibits the production of K2, vitamin K2. Do you know what K2 is? It's an important vitamin to prevent calcification of the arteries. So statin drugs actually inhibit that. Statin drugs actually inhibits your body's ability to prevent calcification of the arteries. Wouldn't that mean that it actually increases your risk of calcification of the arteries? Increases your risk of heart disease? Yeah, that's what I said just a couple of minutes ago. Statin drugs actually increase your risk of heart disease. Didn't you hear that earlier? Yeah, now you know why. Cancer. Research shows long-term statin use, 10 years or longer, more than what? Doubles a woman's risk of breast cancer. If you've been taking statins for 2 years or more, you're tripling your risk of type 2 diabetes. Did you hear that? 2 years or more, you're taking statin drugs, right? Some of you guys just started taking this stuff. Thank goodness you're here right now. That's all I can tell you. Because if you stayed on this stuff, you're building heart disease as the minutes click by. Tripling your risk of type 2 diabetes. So, this is serious stuff. Not only that, but the medications, when you're on statin drugs, you have a greater chance of medication interaction, medication side effects, because what they found in this study, again, Circulation Journal, another medical journal, they found that the statin drugs actually amplify other drugs, other heart medications, like Coumadin. What happens when the statin drugs boost the effect of Coumadin? Hemorrhage, internal bleeding, hello? But it can happen the other way around. If you're taking Coumadin or warfarin or amlodipine, like any of these blood pressure medications, and it increases, it actually amplifies those drugs, or it amplifies actually the effects of the statins, then you start getting muscle pains, memory loss, confusion. You start getting the symptoms, the side effects of the statin drugs, because these drugs interact with one another. And this is what I commonly see when people sit down in front of me and I do, I'm starting to take an intake on there during the consultation. Which medications are everybody on? Blood pressure, and what else? Cholesterol, and then very often diabetes. Yeah, and this is why it's so common now. Have you guys seen the trend of memory loss, dementia, Alzheimer's disease? Have you guys seen that? Yeah. Yeah, worse than ever. Do you think this may have something to do with it? It's part of the picture. I can tell you that. If it's not the cause of it, it's definitely contributing to it for sure. So again, the whole point of me saying all this stuff is for you to start asking yourself questions. Is this you? Or, is this in your health profile? Any family members, people that you know, love, and care about? What are you going to do about what I'm saying? That's the more important thing. Not what I'm saying, it's like, what are you gonna do about it, right? You know, because information without application is what? Hallucination. Hallucination, yeah. We're hallucinating. Okay, so is there such a thing as dangerously high cholesterol? Like really, Dr. Yachter, I mean, can I really let my cholesterol go to 300 or 400? I mean, if your cholesterol was 300 or 400 right now, like, would you be nervous? Would you be nervous? You can be honest with me. Like, if you just left your doctor's office and they said, I don't like where your cholesterol's at. It's a dangerously high levels. This is bad. I don't like it. 400. You're running a 300 or 400 cholesterol. Would you be scared? Would you be concerned? Most people are.
Yes.
Most people are. So there's nothing wrong with that. But let's bring it back to: is there a myth there, or is there truth? Okay. 2018 review presents substantial evidence that total cholesterol and LDL cholesterol levels are what? Not an indication of heart disease risk, and that statin treatment is of doubtful benefit. Journal of the American Medical Association, this is back in 1994, you're going back 25 years. This was put out. This is why the other British medical doctor said for the last 30 years there have been studies. Okay, so this was put out many years ago. They said in 1,000 participants in this 4-year Yale University study, people with low total cholesterol have just as many heart attacks as those with total high cholesterol. Wow, still confusing, stunning, staggering. Really? I mean, just because I take my cholesterol down doesn't mean I'm out of harm's way? No. Matter of fact, you're no better than somebody who's got a 300 or 400 level cholesterol, because you haven't really looked for the true cause of a heart attack or a stroke or heart disease. And once you find that and you have that under control, then it really doesn't matter what your cholesterol is, does it? And we're going to get there. So what's the right question to ask your doctor? New England Journal of Medicine in 2005, they found patients with low CRP. How many of you got, raise your hand if you know what CRP is? CRP, all right. What is it? Anybody tell me? C-reactive protein, thank you. C-reactive protein. Everybody say that. C-reactive protein, okay? If you want to know if you're at a high risk for a heart attack, a stroke, or cardiovascular disease, you need to ask your doctor not what your cholesterol is, but what your CRP is. What is CRP? The indication of your inflammation levels. That is going to be the imminent predictor of whether or not you're going to have a problem. See, they found that the patients with the low CRP levels, the low inflammation levels, had fewer heart attacks no matter what their LDL cholesterol was. And they had more heart attacks if their what? If their CRP was elevated, regardless of their LDL cholesterol. Are you starting to get this? Are you with me? Okay, so when you go to the doctor, they do the blood test every year. They come back and say, hey, I don't like where your LDL is. It's 126, it's 136, right? Oh, your HDL looks good, but your LDL is really high. Gee, doc, what's my CRP? Oh, we didn't do that. Why didn't you do that? Because we don't need that. We just look at what your cholesterol is. But I thought most medical studies indicate that the CRP really is the imminent factor. That's what I've read in medical journals. What do you know about CRP, doc? Is that a fair question to ask?
Yeah.
Sometimes they get mad.
Question, what would be the CRP normal level?
Do you hear what he asked?
Yeah.
What would be the normal CRP?
The reason why I ask is they have put me on blood pressure.
Mm-hmm.
I mean cholesterol.
Cholesterol, yeah.
Statins, forget it.
Mm-hmm.
I have severe reactions with those things.
Right.
So they put me on Losartan.
Yeah.
But anyway, I have noticed that there is a CRP indicator as far as to the blood that
Yeah.
is drawn from me, and I would like to know what that level is.
You have to ask, so you hear what he's asking, so you have to ask your doctor to do that CRP test for you, because usually, more likely than not, they will not do it. They will just look at the blood cholesterol levels. And again, is that an indicator of a heart problem? No, it's the CRP. So before you take that statin medication, you have every right to ask the doctor to go back and run that C-reactive protein. Now, as far as what the normal levels are, 0 to 3 would be a normal level of the C-reactive protein. Can you see that right there where that arrow is pointing? This is what the lab result looks like for when we do it here in the office. We take a finger prick test and we squeeze a little dab of blood onto a card and we send it to a lab, and that gives us the C-reactive protein and vitamin D. And then when we get that back, it shows us where we're at in those levels. So if the C-reactive protein is too high or the vitamin D is too low, then we next go to the proper supplementation to bring those into balance and get those at the right levels. Does that make sense? Okay. So this is where you need to look. Now, if you have a doctor or you have a lab that'll do the C-reactive protein, and you're taking cholesterol medication, or you're a heart patient, or you're not sure, the most important thing you should do is find out where your numbers are. Don't guess. Test. You have to know your numbers. This is so important that we're doing this standard now in every wellness chiropractic plan. If you're a maintenance patient in our office, we just started putting this into the plans. Like, everybody is getting that.
Quest Diagnostic is including the CRP as standard on
Okay.
10-day blood now.
That's good. So Quest Diagnostic will do it as standard, and that's really important. The other thing that's really important now for our day and age is vitamin D, because what studies are showing now is that it's one thing to have a vitamin D level that's in normal range when you're over 30, but more and more studies are emerging that are showing when your vitamin D levels are over 70, your risk of dying from COVID is virtually 0. So knowing your numbers is really important. It's not enough now just to be in the normal range. You know, it's not enough just to get you out of deficiency. You've got to be at prime optimal levels and beyond. If you're serious about your health and your immune system and your heart health, vitamin D has a lot to do with that. Can everybody see that? That's why this test is so important, and we've made it standard protocol in every wellness plan that we do right now. If this is something that you don't have access to, you want us to do it here, talk to Deborah, we'll do it for you. But this is really important. Your inflammation results will tell the story as far as everything that you've learned so far right now. That's the question you have to ask your doctor. What's my CRP levels? What's normal blood pressure? How many of you guys, if you woke up in the morning and your blood pressure was 130 over 90, would you be a little anxious?
No.
If it was 140 over 90, would you be a little anxious?
No.
If it was 150 over 90, would you be a little anxious?
No.
No? So you're learning that as you get older, it's normal for your systolic numbers to drift higher and higher. And that's normal. That's why the Mayo Clinic has adjusted their numbers. American Heart Association has adjusted their numbers. They say if you're a healthy adult, age 60 or older, your treatment goal is less than what? 150 over 90. Okay, so there's a lot of ways for you to influence your blood pressure. I'll give you some suggestions supplement-wise, but what's an easy thing that you can do every single day to bring your blood pressure down? Exercise, yeah, exercise. That's one of the easiest things that you can do. Another study that just came out from China, almost 3,000 patients that they looked at, they found that those with high blood pressure had double the risk of dying from COVID than those who didn't. So is blood pressure important? Obviously it affects your immune system at some level as well. This is why this is important. Blood pressure medication side effects. Again, you know, when people come in and they're complaining of different things, and then I ask them what medications that they're on, it's easy for me to connect the dots. Many times, things like chest pain, shortness of breath, depression, confusion, memory problems, impotence, decreased sex drive, headaches, you know, these are all typical side effects of blood pressure medication. And I've seen this on older patients as well as younger patients. Remember, there's no such thing as a drug without a side effect. And I'm giving you reasons for you to think about what else you can do instead. Now, I'm not here to tell you if you're on blood pressure medication or diabetes medication, I don't tell my patients to leave here and just stop taking that. That requires active lifestyle engagement things to support and supplement that. But I will say this, I'm not supposed to say don't take your medications, but I'll tell you that if you walked out of here tonight and you never took your cholesterol medication, that would not only have no repercussions, it would be the smartest thing that you ever did. Okay? I just tell it like it is. I have all the evidence right behind me, mostly medical studies, pleading with people to stop the insanity. Stop it. Okay? These are all medical studies, medical research from medical doctors, and I'm giving you all of the armamentarium you need to humbly and intelligently stand in front of your doctors and ask intelligent questions, right?
Right.
Because after all, whose health is it? It's your health. Whose responsibility is it? Your responsibility. And because you've taken the time to come here and learn, it's just a matter of time until you have that conversation with your doctor. Because this is the standard of care. You have health insurance, you have doctors, you go every year, and if there's a problem, there's only one solution that they're going to give you. And what is it? A prescription. And if you don't like that, you need to learn how your body works, the right questions to ask, and then the other thing is what to do instead. There may be a time and a place where you need to take a medication in an emergency situation to get things stabilized, but the mindset should be, well, maybe it's temporary. I think I can do this. I can do this. I just need to do some other things instead. Let me get going with this, and then I'm going back, and I'm going to make sure that I'm getting off this stuff. You understand? And that's my wish and my prayer for you. That's logical thinking. So many of you guys are, you've been on this, or maybe you got off. Hopefully you got off valsartan, ibuprofen, losartan, all these blood pressure medications between 2018 and 2019. 4 of them were recalled. I remember going through this with many of my patients, and I saw this coming out, and I was teaching people, going over through the workshop material, and like, I see that you're on this. Did your doctor take you off of that? No. What do you mean your doctor didn't take you off of that? Are you kidding me? So they go back to the doctor and ask the doctor, did you know that this was recalled? Yeah, I've been meaning to get with you on that. No, thank you very much. So there are these cancer-causing impurities that they found in them. Basically, they use these NDMA, NDL. I'm not going to spell it out for you, but basically, it's cancer-causing impurities they use to make rocket fuel. That's what was in your blood pressure medication. And how many years were you taking that? So again, we go back to the fact that most of the doctors that care for us, they're good people. We want to believe that they're there to help us. They get into a profession because they care about people. They want to make a difference in our community and families in the world. But you have to understand that they're working for a system that's flawed. That's getting an F on their report card for healthcare. You understand that? So the question is, how much advice do you want to take with that? And that's where you really have to ask yourself and your doctors some serious, hard questions. You need to get answers and you need to get facts. Otherwise, you run into this after you've been on it for a couple of years, increasing your risk of cancer. God forbid. All right? American Heart Association, January 31st this year, they said, and this is going back to our core 4. You've seen this all over the office: function, fitness, nutrition, and education. And all this is talking about is lifestyle. Lifestyle trumps your genes. How many of you guys have heart disease genes? Heart disease runs in your family, or cancer runs in your family, right? We all have that. You go to your doctor, they ask you that. But the reality is what they're finding now today is that 95% of whether or not you get a heart attack, a stroke, heart disease, cancer, diabetes, 95% of that is not your fate based on who your lineage is. 95% of that is based on your lifestyle. It's based on how you're eating, how you're managing your stress. Are you smoking? Are you overweight for most of the time? Are you eating good? Are you taking supplements? Are you getting adjusted? All of these things are going to trump your genetics, or they're going to allow you to express those disease genes and actually deal with it. So this is what American Heart Association is saying. On average, not smoking, maintaining a healthy body weight, controlling your blood sugar, blood pressure, and cholesterol can add what? How much? 10 years to a person's lifespan. Now, if you could have a conversation with the Lord and ask Him for another 10 years, how many of you guys might do that? Maybe not the way you're feeling right now, but I knew I had to put that disclaimer in. But most of us in the room, we value life. We're grateful. We have a lot to be thankful for. and we love our lives. Yeah, we want to live as long as we possibly can, as long as we're enjoying it, right? So give me another decade. I'll take it as long as I feel good and I'm healthy. Well, what's one of the main things there? Maintaining a healthy what? Healthy body weight. Lose 10 pounds, you're doubling your chances of normalizing your blood pressure. How much? 10 pounds. So if you have a blood pressure issue right now, just quick 10 pounds. Right? 22-pound weight loss reduces your risk of heart attack by how much? By 75%. So I'm going to turn this up so you can hear this. I want you to hear this.
Hello, my name is Tim Kennedy. In the first 40 days of this program, I lost 35 pounds, exactly where I wanted to be. I got off my blood pressure medicine, I got off my cholesterol medicine, and I got off my heartburn medicine, and I feel wonderful.
Thank you. He is one successful case out of about 2,200 people that we've put through this program. So if you didn't know, we have a program in the office. Deborah does an amazing job, and she's really good at what she does. She'll weigh you in. She'll tell you exactly what your weight is, what your body fat is, your visceral fat, muscle mass, water mass, your metabolic age. Most common thing I hear is when you stand on that scale, you're 60 years old, but your metabolism indicates that your metabolism working like a 90-year-old. Wouldn't it be better if your metabolism, if you're 60, if your metabolism was working like a 50 or a 40-year-old? Yeah. So if you lost, 10, 20, 30 pounds, and your metabolism was working less than your chronological age, what's the likelihood that you're going to gain it back if your metabolism's fixed? Little to none. Does that make sense? That's why a program like this it's more important that you fix the cause of the weight gain. Anybody can lose weight. There are many of you in the room, you can do that. You don't have a problem with that. You've done it before. Knock off a quick 10 pounds. You don't have a problem with that. But there are some of you that really need help with this. You need somebody to hold your feet to the fire, and you need to make sure that your body, more than your weight, your body fat comes down. You get the visceral fat down to take you out of harm's way with fatty liver disease and heart disease, and you want to see your metabolism be corrected. And that's what this program is about. It's very specific. We do specific testing. You stand on a special scale that puts a bioelectrical impulse through your body, and it gives us a readout, a printout with all those objective factors. And then what happens is you come back for weigh-ins every couple of weeks, and it's a 40-day program. You have a meal plan, all your supplements are included, and if you don't lose at least 15 pounds, Deborah will put you through a second round at her expense. She knows I'm just kidding. She's good at what she does. So I can't remember the last time somebody went through the program and didn't lose at least 15 pounds. Most of our patients lose more than that, easily 20 pounds. Men tend to lose a little bit more than women, but like we just said, you knock off somewhere between 10 and 20 pounds, what's happening to your blood pressure and your sugar? What's happening? It's gonna get normalized, yeah. And then again, the most important thing is drawing back to the dependence on the medications. That's another thing. Give me 1 second, this is another thing you need to realize also is that and I see this happening, you come to these workshops, and if you're on medication, you're taking blood pressure medication, you're getting adjusted, you lost 10 pounds, now your body's healthier, and it doesn't really need the same dosage as when you weren't, before you started all this stuff. Then what happens? Then you start like, I'm getting dizzy. I don't feel as good. My energy is poor. And you think something's wrong, but really something's very right. Yeah. You just need to go back to the doctor and make sure they're aware of all of this, and they can adjust your medication or maybe take you off. And I see this very, very frequently. You start applying these lifestyle changes, and it's so effective that, boom, before you know it, something like that happens. What were you going to ask?
Well, I wanted to say I had my friend I recommended to Deborah.
Yeah.
She had many, many years she was trying to lose weight. Within 2 weeks, she dropped to 14 pounds.
14 pounds in 2 weeks. Wow. So Elmita's friend.
And she is so
Yeah.
excited.
She's
and
excited.
she said that the menu plan that Deborah gave her,
Yeah.
she could live on it for the rest of her life.
Well, that's the idea. That's good. That's awesome. So it's not just how you look, it's how you feel too. That's great. Thank you for sharing that. I didn't know that. I know she was here at the workshop. That's for sure. Yes, sir.
On the prior page, there was a medication
Yeah.
there that's called Metropol.
Yes.
Be very careful with that thing because one of the severe side effects is that it's stated as being severe weight gain.
Yeah.
From May the 11th till about 3 weeks ago, I was put on that thing. I gained 31 pounds.
31 pounds. Yeah. Not only that, it causes memory loss, and we found that out with my mother-in-law being on that, and it caused her Alzheimer's to progress. She just had dementia. It progressed to full-blown Alzheimer's while she was on that, and now she's in memory care at Artis. Yeah. So he's what he said. Just be careful with that metoprolol.
So
Yeah.
what they did was they switched me over to atenolol.
Yeah.
Supposedly better, but
Right.
I'm keeping an eye on it.
Again, the whole thing is, hopefully it's temporary. If you can knock off some weight, you start, applying some lifestyle changes. We're gonna show you. We're gonna give you the goods here in just a minute. So is everybody with me so far? So, all right. I just want to recognize some of our patients very, very quickly. I know I've been long-winded. Everybody, give our staff a big round of applause. Victoria, Deborah, Tamara. All right. So we have a couple of people that we want to recognize, and this is for perfect adjustment attendance. So for those of you who have kept up with your appointment schedule flawlessly, perfectly, I want you to know how much we appreciate that, because when it comes time to do your progress evaluations, we see that. We see wonderful changes on your x-rays. We not only hear you're feeling better, but we actually see it, and we really covet the results as much as you do. So we want to recognize a couple people here. When we call your name, please stand up. We're going to crown you with a ribbon, a Medal of Honor. Elmita Hansen, we give her a round of applause. Evelyn Richardson, and Chris Holmes. Give them a big round of applause. And Evelyn, I want everybody to know that today is Evelyn's birthday. So we want to sing happy birthday. Happy birthday to you. Happy birthday to you. Happy birthday, dear Ellen. Happy birthday to you. Woo! We love you and appreciate you. Getting younger with every adjustment. Right? All right, so up here you see an artery. You're looking down an artery. Now, you see all that yellow stuff? It looks like custard or mustard or whatever that is. What is that? It's plaque. It's building up. And what is it doing to the middle of the artery? It's closing it down. So I'm sure at some point you guys have all seen something like this, and then there's the news report that says this is what is heart disease, cholesterol causes it, eating saturated fats, fatty food causes it, and that's the question that we want to ask ourselves. Is that a myth or is that a fact? Well, the answer is no. Cholesterol does not cause that. Coronary artery disease has more to do with what? Oxidized cholesterol, not the actual cholesterol itself, but when the cholesterol actually oxidizes. What did we say that LDL is? Is it cholesterol or is it something else? It's protein. Some of you have been to the workshops before. We spoke about a process called glycation, and that's when you have a protein entangled with a carbohydrate. So oxidation occurs in your blood vessels when you have sugars come into contact with this protein, this low-density lipoprotein, the LDL cholesterol. And the sugar physically modifies it and causes the oxidation. So that's what attaches itself to the LDL and changes the shape of it, renders it useless, and then it just builds up from there. Again, what is the cause of that? Sugar. Causes free radical production and inflammation. So what does sugar cause? Inflammation. What does sugar do to the arteries? Swells it shut. So this is the process that's going to cause the atherosclerosis. This is the process that's going to increase your risk of a heart attack, a stroke, myocardial infarction. Are you with me right now?
Yep.
Is it the cholesterol? No. It's what happens to the cholesterol when we make poor lifestyle choices. It's what happens to the cholesterol, what we do to the cholesterol to cause it to become a problem. And what is that? The sugars. So, again, you know, if you're running a 200-300 level cholesterol or an LDL that's 140, 150, 160, you got lots of LDL there, but again, that's not the problem. But now you've got a good foundation for that sugar to wreak havoc on. You see? So if this is what your daily intake looks like, lots of juice, sugar in that, high fructose corn syrup in the ketchup and the tomato sauce, high fructose corn syrup obviously in the drinks, our Arizona iced tea, or our soft drinks. We start our day with sugar and lots of the cereals, our Pop-Tarts, our fruit roll-ups. All right, all of our pantry is loaded with these things. And then on top of that, we have things like corn, pasta, rice, grains, potatoes, and all these things, which break down into what? Sugar. So what are we talking about? We're talking about a hormonal response. Anytime you've got sugar, anything that breaks down sugar, what happens to insulin? Starts going up. And then hormonally, what is your body doing? It's storing fat, but it's also driving inflammation. You got that? So when the sugar, the more those sugars go up, if you're not watching this, if you're just eating mostly sugars and proteins and eating whatever you want, like, hey, wow, I had a good piece of salmon, had a nice baked potato, but then you had the bread, and then you had the pasta, or you had the potatoes on top of that. This is what's wrecking it. This is what's doing it in. So what if instead you just had lamb chops with asparagus, right? What if you just had a chicken breast and some mixed veggies? What if you just had a piece of salmon and some broccoli or cauliflower? What if you just left the breads and the potatoes and the rice and the pasta? What if you just left all that stuff out? What would happen to your insulin levels? It would stay way down. And what would happen to all the extra 10, 20, 30 pounds? Bye-bye. And you wouldn't even have to try hard. It would just leave your body. You know why? Because of the hormonal response. Instead of your body storing fat, now it's what? Burning it. How do you burn fat? Get rid of the carbs. Now, for some of you guys, it's worse than others. Some of you, if you're on medication, if you're overweight, you really need to just cut it out, eliminate it. If you're thinking, well, maybe I'll just reduce it, dial it back a little bit, you're done. That's not how winners think. Winners think like, I'm drawing the line, and I'm doing this now because this is life or death. So it's time to hear the roar of the falls. You know, going down toward Niagara Falls, you're in the canoe but no paddles. Can you hear the roar of the falls yet? Can you hear it? Because it's coming up fast. And so now's the time to get both oars in the water and get serious. Draw that line in the sand. Throw the stinking carbs out. You don't need it. You can eat good food and be satiated if you just have some good fat in your meals. Look at the artery up there. See that artery? Clear, hollow, clean. Is it possible for you to have a 300 level cholesterol or a 150 LDL with an artery that looks like that up there? Sure it is. And if you did, and your arteries looked like that, how would your diet look? Pretty clean, just like I discussed, right? So it really doesn't matter what the cholesterol is. It really matters as far as your body being able to process everything nutritionally. But look at the down below. You see what's building up in there? The plaque. Okay, so you got the plaque in there. That means you got cholesterol that's circulating, and then what's coming to attack the plaque? The sugar. Very good, the sugar. And then what does the sugar do? Once it binds with the low density lipoprotein, it physically modifies it, right? It starts hardening it. And that's what causes the what? The plaque. And the inflammation, like from toxins, from sugars, from bad fats, all these things, the low-fat diet, that's what's fanning the flames. It's like a Brillo pad inside your arteries. And that's what they describe it as, really. So you have to understand that. That's why the Journal of the American Medical Association published that many years ago. They said just as many people die with low cholesterol as with what? High cholesterol. Because any doctor can write a prescription to get your cholesterol under control if your arteries look like that. And you just keep on eating your carbs, keep on having your sodas, keep on having your pasta and potatoes, but you got your cholesterol under control. Guess what? You're still done. You're done for. It's going to happen. It's only a matter of what? Because the cause of the problem is still there. So we see this time and time again, and this is what the medical studies show. Just because you have a normal cholesterol level, it doesn't mean that you're out of harm's way if you're controlling it with cholesterol medication. And in fact, everything that you've learned tonight tells us the opposite, that you're putting yourself even more in harm's way if you are taking cholesterol medication. So what about eating bacon and eggs and steak and all these high saturated fat foods? Can that cause my cholesterol to go up if I eat foods that are high in cholesterol? Could that cause my blood cholesterol to go up? Well, let's look at what the study shows. 340,000 people followed from 5 to 23 years. 340,000 people, that's a large population study. Yes or yes?
Yes.
What did it show? The intake of saturated fat was what? Not associated with a risk of coronary heart disease, stroke, or cardiovascular disease. So if you eat foods that are high in cholesterol, like eggs or meat, maybe your cholesterol, your blood cholesterol goes up a little bit, like 20 or 30% of the food cholesterol causes your cholesterol to go up in your blood. But again, does that translate to a threat? It's not the cholesterol, it's what? It's what you're doing to it to physically deform it by way of what you eat, right? So this is why the studies are actually showing this. The risk for heart disease in this group was 19% lower for the group consuming the what? The highest amount of saturated fat. Time magazine put these out in 1984. The bacon and the eggs with the sad face, and then the avocado and the eggs with the happy face. What was it, 15 years later? Yeah, so, you know, this is what happens. The junk science can only get, you know, it's only a matter of time before it comes out in the wash. So that's what we're talking about here, so you guys know. So the hydrogenated oils, the rancid vegetable oils, the trans fats, these are the things that are going to physically deform the cholesterol in the artery and cause the inflammation and cause the arteries to swell shut. See all that stuff there? That seemingly looks healthy, right? Bread, pasta, the rice, all of that stuff, which may have some nutritional benefit, but if you're a heart patient, that's going to do you more harm than good until you get things healed up, right? Yeah, and once you get things healed up, maybe have a little bit every now and then. It's not going to kill you, but you have to know who you are and what your limitations are. And we have to be realistic with ourselves. We have to be honest with ourselves. If you want to get into fat burning and you want to decrease inflammation, the lifestyle on the right, those nutritional habits are going to be conducive to that. And what do you see? Good fats like coconut oil, coconut, grass-fed butter, right? Avocados, an avocado a day keeps the doctor away. Almonds, olive oil, right? Eggs, salmon, you know, good fatty fish. Eggs are it's like almost the perfect food that God created for us. Are they high in cholesterol? Yeah, you better believe it. Do they cause heart disease? No, not at all.
We had to throw half of it out for years.
I know for years they said that the yolk has all the cholesterol, throw it out. It's the worst thing that we did. Our brain needs that stuff. So look at, again, you go back to look at the trend of Alzheimer's, and a lot of it is traceable back to not just the medications, but the nutritional recommendations that we were given. You know, low-fat diet. The worst thing that we did. We need that fat. You need the good fats, you need the saturated fats. Just get rid of the trans fats. So you've known this, you've seen this before. Now, obviously, we need to apply it. Another easy thing that I want to share with you to do for breakfast is just take 2 scoops of this, the Complete Clean. It's got 26 grams of protein, a handful of carbs, which is really just from fruits, complete spectrum of multivitamins. It's got antioxidants and also has a low-level detox. And I like to do this because it keeps my blood sugar stable. I have a couple of scoops of this. This is my breakfast after I work out in the morning. It's got my protein in there, and I'll have this with berries and almond butter. And you can mix it with almond milk or coconut milk. This is what we call the breakfast of champions. I have patients that have all they've done is replace their breakfast with this and keeping their insulin levels lower. They get their day started off like that in fat burning, over the course of a few months, they've lost 10, 20, 30 pounds by doing nothing but that. Yes, Jim?
Yeah, I started dumping olive oil in my shake in the morning. It really tastes good.
Really tastes good. All right.
I didn't think it would.
Okay. Any takers on the olive oil there in the shake? I'm gonna have to brave up and try that. Okay. All right. So I would recommend that again. So it's also got some anti-inflammatory properties in there. Also, this is part of your supplement suite. The Ultraplex Cardio has something in there. If you're a heart patient or you want to be preventative, proactive, this has something called L-arginine in it, which is the precursor for nitric oxide. Nitric oxide is a smooth muscle dilator. Basically, it causes to the artery there's muscle on the outer wall or the inner wall, really. So when it contracts, it opens up the blood vessel. And so what that does, when you open up the blood vessel, it helps to stabilize and lower your blood pressure. And it also causes elasticity for the arteries, which is really healthy for your heart also. So the other part of your supplement suite is vitamin D. As we said, it's necessary for heart health. We also spoke about how important it is for your immune system and numerous other things. CoQ10 we talked about as far as cholesterol, stripping that out of the cells and how important it is to make sure that you're being supported with that. By the way, if you have a doctor that has you on cholesterol meds and has not recommended CoQ10, that's all I'll say about that. I think you guys get that. That's pretty much standard of care. Yeah, promotes normal cardiovascular function. CoQ10 synthesis, it's disrupted by the statin, so you're more prone to get side effects if you're not taking a CoQ10 supplement, like fatigue, shortness of breath, vertigo, muscular pain. So that's why this supplement is so important. EPA and DHA. So Victoria said earlier, I asked her, what does EPA, DHA do? She's like, well, what doesn't it do? I said, well, that's a good answer. It lowers your blood pressure, prevents arrhythmia, it helps to balance your blood sugar, it helps with your cholesterol, your blood clots, counteracts inflammation. It helps to prevent cancer. There's so many benefits from the fish oil capsules. It should be a daily foundational part of what we do for supplements. So all four of these together have been grouped together for one reason and one reason alone. Not just for heart health, but when you take all of these together, they have an amplified effect. They support one another as far as your heart health, and they work very well together. They're synergistic. So that's why we give you the discount. If you're watching online, it's also available online at elevationhealth.com. Just go on there, click on the shop online button, and you can create a shopping cart. But if you're here tonight, we have limited quantities, and we only discount here at the office the night of the workshop to allow you guys to make application with what you've learned so far. Okay, I want to close out with this. So we've talked about nutrition, we've talked about exercise, talked about supplements, all these things so that you could be proactive with your health, right? All important things. What if I told you there was one more thing that has preeminence over all those things? There's one other thing that will determine whether or not you get a heart attack or determine your heart health that's even more important than your nutrition, than your genetics, whether or not you exercise. You know what that is? What controls your heart? What's making it beat? What's making it go faster or slower? Which system? Your nervous system. Is there a way to measure the activity of your nervous system, or whether, as far as whether or not that's going to create a problem? Well, let's look into it. And research shows now that HRV may actually be one of the most important biomarkers of cardiovascular health, more important than cholesterol, CRP, or even blood pressure. What's this called? HRV. What does that stand for? Heart rate variability. How many of you guys have ever had this done, heart rate variability? Well, if you're a patient in my office, you have. Yes, and you will continue to have it done, and here's why. There are two branches to your autonomic nervous system. You know, you have your nervous system that runs everything, right? But there's two parts to it. One part speeds it up, and one part slows it down. Did you know that? So your sympathetic nervous system basically speeds things up, like your heart rate, fight or flight. If a tiger's chasing at you and you're running for your life, all systems are shutting down and all the energy is channeled to the muscles, right? So it's fight or flight, it's needed for short-term survival. Then you have your parasympathetic nervous system. Your parasympathetic nervous system is rest and digest, rest and recovery. It's used to slow things down, slow the rate of your heart, slow the rate of your digestion. So these two systems must be in balance. When they become unbalanced, your body cannot handle stress as well, and you're more likely to have a heart attack, you're more likely to get cancer, be infected by a virus or COVID, and here's why. So you look at that system, that chart on the right, can everybody see that? You see the yellow branches that come off the spine and go to the organs?
Yeah.
You know what the yellow is? That's the sympathetic part. That's the fight or flight. That's the short-term survival. That's what raises the rate of all the functions there. Do you see the green lines that branch off from there? On the top, they go to your eyes, your heart, your lungs. On the bottom, they go to your colon, the reproductive organs, the kidneys. Can you see all the green lines there? That's the parasympathetic. How many of you guys have seen that chart before? Everybody, right? Because what does it show you? What system controls all the organs in the body? Your nervous system. Yeah. So that's how important this is. There has to be a good balance there. Now, what I want to show you is something called the vagus nerve, because the vagus nerve is what's going to be modulating through your parasympathetic and sympathetic nervous system. Your vagus nerve is what controls the response to the heart, making it faster or slower. What's it called? The vagus nerve. In Latin, the word vagus means wanderer. And what that means is that vagus nerve is going to really reach out and touch every part of the body. But primarily for controlling heart rate, it works through the vagus nerve directly. The vagus nerve modulates heart activity, slowing heartbeat and relaxing your heart when the parasympathetic is activated. And when the sympathetic nervous system is activated, your vagus nerve will what? Accelerate it. Yeah. So the vagus nerve is really what's responsible for raising or lowering your heart rate. Why is this important? Because when these two branches are in balance, you're healthy. Your body's in a ready state, like I said, and it reduces your risk of heart disease. When it's out of balance, you're what? Increasing your risk of heart disease. Wow. So yeah, this is what research shows. 2004, here's what they found. The parasympathetic activity of patients with ischemic heart disease is 1/3 lower on average than on a healthy individual. So what they're saying is that when those two systems become unbalanced, your risk of heart disease, ischemia, what does that mean? Shutting the blood supply off to your heart. What does that sound like? A heart attack, myocardial infarction. What did they find? 75% of the patients, the parasympathetic was 1/3 lower than it should have been. That meant that the sympathetic was in overdrive and dominant, contracting the heart, contracting the muscle, shutting down the blood supply to the heart, causing a what? Heart attack. In order for you to have a heart attack, you must experience with a drastic decrease in parasympathetic and an increase in what? Sympathetic. 75% of myocardial ischemic events are triggered by the what? Autonomic nervous system. Your what? Autonomic nervous system. And what does chiropractic do when you're getting adjusted? What does it bring balance to? Your autonomic nervous system. That's why people under long-term chiropractic care take less medications, go to doctors less, have less heart attacks, less cancer, and live longer and just go to the doctor less. Because we're keeping your one system that controls everything else in balance, being proactive. How about that? Your heart attack risk is primarily dependent on the functioning of your autonomic nervous system. Studies indicate your risk of dying from a heart attack significantly increased if you're what? If your heart rate variability is low. So, the question is, how do you determine if you are in autonomic balance or not? How do you know what your heart rate is? The heart rate variability by getting a what? Heart rate variability test. So when you started here, we did all types of testing. We did the thermal scan. We checked your posture, palpation. We did all these things. And then as time went on, we started working with you, and we started doing these scans. And if you're a maintenance patient, this is one of the things that we use primarily to make sure that you're moving away from disease instead of towards it. How many of you guys go to the doctors every year? You go to the doctor every year. They do the blood test, they do this, they do that. And when they find something wrong, it's too late. Wouldn't you like to know if you're heading in that direction long before you get there? Yeah. So what do we look at? Every year we look at a new x-ray, we look at a new heart rate variability, we look at a new thermal scan. And that's our plan for wellness, to make sure that we nip it in the bud before the doctor gives us the bad report. Right or right? Right. That's the whole purpose of wellness. What good is a blood test or an x-ray after it shows cancer? Then it's what? It's too late. We want to know whether or not your nervous system is strong enough to make new healthy cells instead of cancer cells. Don't you want to know if your nervous system is imbalanced or not? Are you going to let it go unbalanced, allowing you to develop a heart attack, a myocardial infarction, or ischemic event? Or do you want to nip that in the bud, making sure that it's imbalanced? So we look at your heart rate variability. We want to see as much green as possible. Otherwise, you may need to go on a vacation. Other than that, where does the vagus nerve, what did we say the vagus nerve controls? The what? The heart, making it faster or slower. Where does the vagus nerve come off? Where? At which level? C1. C1, the top bone in the neck, runs right in front of it. So what happens if the top bone in the neck is out of alignment? How does it affect the vagus nerve? It can stimulate it. It can put it into overdrive. And what can that cause? What type of symptoms can that cause when that top bone is out of alignment? Well, look at the top there where that nerve chart goes. What do you see? Headaches, nervousness, insomnia. Everybody ever have one of those nights where you're staring at the ceiling? You wake up every hour and you look at the clock. It's only 10 o'clock. It's only 11 o'clock. It's only 1 o'clock. It's only 2 o'clock. It's only 3 o'clock. Right? You're like up every hour. Let me tell you, your atlas is out of balance. You're out of autonomic balance. You need to be adjusted. You can't sleep through the night properly. You come in and you lay on the table and you make sure I check this area. How many of you guys notice that I have this little thing that takes your temperature right here? Do you know why I do that? To see if you're in autonomic balance. I want to see if the temperature is balanced. If it's not, you're out of balance. And when do you want that fixed? Immediately. Do you want to go a week being out of autonomic balance? A month? So that's what this is about. Making sure that we're preventing problems. Nervous breakdowns, insomnia, migraines, tiredness, dizziness. You guys have the answer. Isn't that amazing? You have the answer. Yes,
I
Fiona?
have a question.
Yeah.
Would that cause vertigo if it's out of balance?
Yes, that's one of those things, right? That's actually the last one at that top level. Dizziness, right there. Chronic tiredness and dizziness. You ever feel like that? You wake up in the morning and you look down, you're like, whoa, whoa. Before you go to your EENT, come in here, lay on the table, and let me check and see if you're out. It could save you a trip to the doctor who's just going to do what? Probably give you more medications, right? And not correct the cause of the problem. Have I had that happen? Yes. I remember it was a couple of months ago. I was laying up in bed. Every hour I was up. Every hour I was up. I'm like, man, I need to get adjusted. Man, I missed my adjustment this week. And I rarely ever, if ever, unless I'm out of town, I go every single Wednesday, just like many of you guys do. And I missed it that 1 week, and it was on Friday. I didn't sleep all night. And I went 10 days. I'm like, yeah, that's not like me. So I went, and I got it fixed, and I slept like a baby that night. So I can't tell you how important this is. And you may not realize this, but I do. By you continuing with regular adjustments, week in and week out, every couple of weeks, you may not realize this, but you don't know when that last adjustment may have saved you from a heart attack that you could have had. But we nipped it in the bud with that last adjustment, or the adjustment that you had 6 months ago. You just might have come in right on time and never know. You have absolutely no idea, because you're staying proactive with your chiropractic care, not because your back pain went away or your neck pain went away. How many of you guys have neck and back pain? Oh, I do. Yeah. Do I get adjusted? Yes, sometimes it makes my back feel better. Sometimes it doesn't. I'm not afraid to tell you. I don't get adjusted for my back. I've been getting adjusted for 35 years. My back, on average, feels just like yours most days. I get adjusted to stay as healthy as possible so I could live my life as fully as possible. And because I understand what controls function and healing in the body, and I eat good and I exercise, and I want to think right just like you guys, but I don't care what supplements you do and don't take. I don't care how often you do or don't exercise. I don't care what kind of carbs and pasta and junk you do or you don't eat, but you clean up all that and you don't get adjusted, you're on the wrong side of the coin. You're on the wrong side of the coin. The most important part of your health that gets preeminence is what? Is the chiropractic adjustments. You go without that and everything just starts shutting down. You're not firing on all cylinders. The most important thing is the chiropractic care. Because ultimately, what's controlling whether or not you're making new healthy cells? Your nervous system. Ultimately, what's controlling your heart? Your nervous system. Ultimately, what's controlling everything that has to do with your health? Your nervous system. God put the most amazing healing power inside of you. When He breathed life into you as a living being, it stayed on board. It never left you. Right? His word says, I will never leave you, I will never forsake you. And that amazing intelligence that He breathed into you is still inside of you. And the reason why you have a nervous system is because that infinite wisdom that gave you life knew that there must be a communication system, an information superhighway communication system to be communicating, to develop you as a fetus, an embryo, right? A fetus all throughout the developmental process and keeps it working now. You're breathing, right? Your heart's beating, your lungs are breathing, your stomach's digesting food, you're seeing me, you're hearing things. All these things are happening through which system? Your nervous system. The only logical question for somebody to ask is, do I want interference to that system? Or do I want it to be clear? And that's how you use the chiropractic adjustment to bring clarity to the one system that controls and runs and regulates everything else in your health. And so, I guess I'll just wrap up with this. So I forgot I had that in there, but it's one of our testimonials.
So please state your name and rank.
James Jackson.
So James, you've had some great results here in the office. You've only been under care, 4 or 5 weeks or so, and so what were some of the issues that you came in with?
I came in with high blood pressure, constant headaches, lower back pain, and just felt blah.
So how are things coming along for you since you've been getting adjusted in the office?
I feel great. No more headaches. I'm off my blood pressure medicine, and my back is feeling really good.
Awesome.
And I'm actually exercising.
That's good. So life is better.
Yes, sir.
That's great. Well, that's
So I'll just leave it at that, and I want to say again, when we talk about information that's important, did you guys learn something important tonight?
Yep.
Okay, so you learned a lot, but what's the most important thing that you learned about the nervous system? Yeah. So if you got loved ones, family, friends, guests are here tonight, this is for you. For those of you guys who are under chiropractic care, I'm not preaching to the choir. I'm talking to people who actually are not under chiropractic care, need to get their nervous system checked. And that is when somebody comes into the office, we sit down, we do a consultation, we do an examination, with palpation, posture, range of motion, we do the thermal scan. If it warrants, we take x-rays also to line up with all the objective findings that we have. Normally in our office, it's about $350 worth of service. But as a guest, family member, friend, if you want to take advantage or give somebody that gift, it's only $47. And if you'd like to do that, you can see Deborah. If you're a guest here tonight, you're welcome to take advantage of that tonight. If you have a family member at home, somebody you know who should have been here, and you want to do that as a gift for them, you're welcome to do that. It's an amazing gift that you can give to somebody who really, if they do need it, please take advantage of that. But again, the offer's only good for tonight. Normally we don't include the x-rays. Again, it's a lot of work that we do, and we're happy to do that for those who need it. So that's how we make application with the most important part, which is the nerve part. Yes?
Dr. Yachter, I want to ask you, how can I talk to somebody that doesn't believe in chiropractor? They need it, but there's a lot of people talk down on chiropractor and say you don't need someone pressing on your body all the time, and they this, they that. That's what's stopping people from coming in.
How do you talk to people? How do you help people who aren't believers in chiropractic? Well, this isn't, it's not so much chiropractic as it is the nervous system. So you can give them these charts and show them how the back, is intimately related with all function and healing. And we normally give this to all of our new patients when they start, so you can use that to show them, well, You may not believe in chiropractic, but your nervous system controls everything, and you just need to check and see if there's anything interfering with that. And so that's another way to do that. Or bring them to a workshop, right? Did everything make sense the way it was presented tonight? Yeah. It all has to work together like pieces of a puzzle. I just told you what the most important piece was, that's all. Learned a lot more too.
Coming for a lot of years.
Mary, you've been coming at least 12 years, right? Or more, yeah? Keep learning, keep growing.
Yeah.
Thanks for coming tonight, guys. I love and appreciate you. God bless. If you need to see Deborah, she's over here. New patient appointments, the CRP, vitamin D tests, or the weight loss, anything that you need, see Deborah. Need supplements, go over to the front desk and they can help you up there. Thank you, guys.